My name is Kelsey Zundel, and I'm going to talk with you about how to care for patients with dementia. First off, what is dementia? Dementia is a disease that occurs to some individuals as they age, causing memory loss, difficulty with language, activities of daily living, problem solving, and other thinking abilities. Dementia is caused by the brain deteriorating, and there is no known cure. In this picture on the left, that is the brain that has Alzheimer's, and the one on the right is compared to a normal brain. This was just a cute little video that I found of some kids on YouTube. I'm going to post the link for this because my computer isn't recording the sound on my screen, but I'll go ahead and post that as I post this recording. How to care for a person with dementia. So some of the things that are most important is to be able to join their reality, get their attention, give step-by-step instructions, ask simple questions, reminisce, and find out what they like. So it's important to be able to join their reality because a lot of times people with dementia are going to revert to things from their life when they were younger. A lot of times with dementia, long-term memory is more intact than short-term. So one of the things that you'll see a lot is, let's say you've got a man that was working for his whole life. Well, he's going to be probably irritated and wanting to go to work or saying he's late for work or needing to get to work. Well, if you can get down on their level and say, okay, well, where do you work? Maybe start to ask them things about their job and kind of start to reminisce and ask them questions about what they like to do at work, things that they do for work, where their company is, like things like that. Or if you can even redirect them and say, oh, it's Sunday, the company's closed today, we don't have work, and maybe there's another activity like church or something that they're involved in. We need to make sure that during all this that we are getting their attention. One of the biggest things for getting their attention is making sure that we are their sole focus. By doing that, we need to make sure that we're trying to limit noise, trying to limit other people around, like turning off the TV, the radio, trying to care for them in their room by themselves, just so that we're able to get their full response and their full attention so they can react with us to be able to help us out as we're providing them care. And another thing that goes in with that is step-by-step instructions. This is important because a person with dementia, like I mentioned, their short-term memory is not always intact. So if you tell them, we're going to stand up, walk to your room, get in the shower, and then after you can come have ice cream, they're not going to remember all of that. That's going to be very overwhelming for them, and you're going to have to keep repeating yourself over and over and over again. So start small and say, okay, let's stand up once they're up. Okay, let's go walk to your room now that they're in their room. Okay, do you need to go to the bathroom? Do you need to get in the shower? Kind of things like that. Asking simple questions. What do you need? Do you need to go to the bathroom? Do you need to get in the shower? You want to ask questions that have more of a closed-ended answer, or giving them options. What would you like to wear today, this blue shirt or this white shirt? Just because it helps a lot when they're not having to try to think of an answer. It just helps care for them a lot easier, makes their life a lot easier. And then finding out what they like and reminiscing, that is the best if you can talk with their family and just find out some things about them, which could be like favorite colors, smells, things they like to see, things about their family, just things like that, so you can be able to talk with them in a conversation when they're seeming to get a little restless. What to do when your patient is restless or agitated. The thing that I feel is most important is the 4 Ps. These are pain, potty, position, and personal items. So every time you're going into somebody's room, you need to be asking these things. Are you in pain? Do you need to go to the bathroom? Do you need to be moved around? Like, do you need to sit on your bed? Do you need to sit in the chair? Do you need to get up and go for a walk? Personal items. Is there something out of reach that they need that they can't get to? Or maybe they need to change their clothes, or maybe they want to call their daughter, or something like that as personal items. And then grounding techniques is orient to surroundings in 5 to 1. So grounding techniques, orient them to surroundings. So that would just be, if a person is seeming to be really irritated and restless, and let's say they're trying to like pick something up and break it. Well, you want to try to get them in the situation and say, why are you trying to break this? Well, how about we do this with this? Or this is not yours, this is so-and-so's. Can we go to your room and get yours? Kind of something like that. And then 5 to 1, this works sometimes and sometimes it doesn't. So some of the tips for 5 to 1 that I've noticed is try to orient them to things about themselves. So one of the things that I have noticed the most is, let's say somebody is wearing like a yellow shirt or something. Have them look at their shirt and ask if they can tell you what color it is. Like, just try to orient them to a lot of things that they can see around them that are immediate and close. Just because if you're trying to ask them, like, what kind of bird is that outside, like something they can see outside, like that is something that's going to be a lot harder for them to focus on and be able to remember, whereas if it's on their personal like belongings, or if it is like them themselves, it's going to be a lot easier. So 5 to 1, this would be 5 things they can see, 4 things they can touch, 3 things they can hear, 2 things they can smell, and 1 thing they can taste. This also helps with anxiety, but it's just one thing that I've noticed that can sometimes help a lot, especially with agitation. If somebody's really anxious and agitated, maybe they just need a sucker so that they can calm down a little bit and just have something else that is a different focus rather than whatever else is going on. Another thing that's really important with that is making sure that noise levels are down, because that can also increase agitation and restlessness. So some things with this is reorient and reassure. I kind of had already brought that one up. Assure safety. So this could be things like making sure that there aren't things in a walkway. Let's say somebody's up and agitated and walking all over the place. You want to make sure there's not clutter and things all over the floor they're going to trip on. And then if they're really agitated, make sure, and they're like somebody that is going to be physically aggressive, just make sure that they're away from everybody else and other residents or away from other staff members. Kind of give them their space. It sounds awful, but everybody has the right to fall. We try not to allow that to happen, but if somebody's going to beat you up and their other whatever is going to happen that you're trying to keep them from happening is falling, there's not a lot we can do. We'd rather ensure our safety, because you have to care for yourself before you care for somebody else. Discuss their interests or topics. I kind of had talked about that before, like find out from their families of things that they like and bring that up with them. Sometimes they just have a hard time seeing, and so it can make them agitated because they can't see, and so turning on the lights can just help to brighten around their surroundings. And sometimes it's too bright, so you need to be closing the blinds or the curtains. Check in on their basic needs, the 4 P's like I mentioned before. Offer an easy activity. This could be something like coloring, a puzzle, maybe reading a story, and then just make sure that we're in a positive mood with these guys. It might be hard for us to be able to deal with this agitation, because this is something that is definitely repetitive that we'll deal with every shift, but the more that we can be in a good mood and act positively with these residents and patients, the better outcome we're going to have. Communication tips. So like I've said a lot, try to get into their reality. So like I said earlier, if somebody's worried about getting to work, try to tell them it's Sunday, there's no work. And we're not supposed to lie to our patients, but if somebody is very agitated like this and the only way to get them to calm down is telling them it's Sunday so there's no work, it's okay to tell them it's Sunday, even if it's like a Wednesday. Don't argue or discredit. This can just make them more angry. That's the same thing with not saying no or telling them to stop. We always want to try to get on their level. So if somebody seems that they're maybe like trying to get out the door because they have to go to work or something, we don't want to argue with them and tell them, no, you don't work anymore because you're old and you have dementia. You're just going to want to try to get on their reality, because it does help a lot more than try to tell them no or stop, because no and stop can just make them very angry. And then short and simple, we want to make sure it's not childlike, just because they don't remember long sentences and huge communications, and their long-term memory is more intact, so we just need to try to make sure that we're referring a lot to that. And then one-step instructions, like I brought up earlier. Be patient with these patients and these residents, because a lot of times their response time is slower because their brain is so shrunken and there's wide gaps between all of their synapses in their brain, which are just how the brain communicates with each other. Sometimes it takes them a minute to get their answers out, so just be patient. They're very repetitive. Sometimes you have to allow extra time, because sometimes it might take 5 minutes to get somebody dressed and put all of their everything together so they can go. But sometimes it's going to take an hour because they can't remember how to put on their shirt or put on their pants or tie their shoes. And we always want to try to encourage all of these patients to be able to do the most care that they can for themselves. And then also what I brought up earlier was just prompting memories, reminiscing with them, and then again being gentle and kind. If you have a patient that is constantly refusing, try to follow their patient preferences. So a way that you can learn these is by asking their family when they come in, just kind of say, hey, what kind of things, like when does this person like to shower? What are some things that you've noticed that they do when they have to go to the bathroom, like things like that, just so that you can kind of learn what they like. Or maybe it's how they like their coffee, if they like cookies, if they like sour things over sweet, kind of things like that, just to try to get them to better react with you. And then keep a routine. Try to wake them up around the same time, have meals at the same time, and then get them to bed at about the same time. In a happy voice, say, we need to do this, or let's do this, or how about we go in here and do this, just to try to decrease them refusing. You can also put in there if you know like their family members or something, or you could say, your wife said we need to go shower because you're going to go do this. Sometimes it helps a lot more to get their family members involved, even if their family members really aren't saying these things or getting involved. Have supplies ready. Because if somebody's refusing, it's best to have everything together right then and there, because if all of a sudden they don't refuse, you have to have it all. You don't have time to go get it all together. Explain in simple terms, like step by step, like I said earlier. These people may be afraid. They don't know you. They don't remember you. Their long-term memory does not have you involved. And so if you're a caregiver, and even though you've been coming in for months and months, you might be a completely new face because they can't form new memories very well. And then if they're being aggressive, kind of like I said earlier, step away and try again later. If they are somebody that's a fall risk, they have the right to fall if they are being aggressive. You need to care for yourself before you care for somebody else. Pacing tips. So some of the things is just to walk with them, hold their hand, reassure and comfort them, offer them a snack, to check the 4 Ps again, distract them or reorient them if possible, keep walkways clear. We want to decrease falls if we can. Encourage exercise and sleep, and then encourage life habits or tasks. So the reason that holding their hand is important is because a lot of these people don't have a lot of physical touch, so just that small little interaction just helps to brighten their day and can even calm them down quite a bit. Offering a snack, maybe they're hungry and that's why they were up. And then encouraging life habits or tasks. If somebody was, let's say, like a janitor at a school, they're used to cleaning all the time. That might be something that they're looking forward to doing. Or if they were somebody that stayed at home all the time and they did the dishes and they cleaned the house, like that could also be something that we need to be aware of that they might enjoy doing. Some of the overviews. So not every person with dementia will be at the same level of memory loss. Not every person that ages is going to have dementia either. This is case by case. Use the 4 Ps every time you're rounding for agitation. And about that was potty, pain, position, and personal items. And enter their reality. Don't say no or stop. Attempt to redirect them without it. Use the 5 to 1 technique, which was the reorienting them to reality as the things they can see, touch, hear, smell, and taste. And these are some of the references that I used. Hope you guys enjoyed.